Inspired by the heritage of Metrodora, a Greek physician who wrote the first known medical text to be authored by a woman. The Metrodora Awards seek to acknowledge women leaders in science and medicine, covering all disciplines of scientific research, clinical practice, health education, health policy, mental health, as well as patient advocacy. The awards are hosted by the International Alliance of Patients Organizations and title sponsor Beatrice to recognize women leaders and innovators in key emerging regions. This year, the awards are focused on 4 categories in science and medicine: clinical practice leader, public health leader, patient champion, mental health leader. Visit the Metrodora Awards website to learn more about the awards program. Inspired by the heritage of Metrodora, a Greek physician who wrote the first known medical text to be authored by a woman. The Metrodora Awards seek to acknowledge women leaders in science and medicine, covering all disciplines of scientific research, clinical practice, health education, health policy, mental health, as well as patient advocacy. The awards are hosted by the International Alliance of Patients Organizations and title sponsor Beatrice to recognize women leaders and innovators in key emerging regions. This year, the awards are focused on 4 categories in science and medicine: clinical practice leader, public health leader, patient champion, mental health leader. Visit the Metrodora Awards website to learn more about the awards program. Inspired by the heritage of Metrodora, a Greek physician who wrote the first known medical text to be authored by a woman. The Metrodora Awards seek to acknowledge women leaders in science and medicine, covering all disciplines of scientific research, clinical practice, health education, health policy, mental health, as well as patient advocacy. The awards are hosted by the International Alliance of Patients Organizations and title sponsor Beatrice to recognize women leaders and innovators in key emerging regions. This year, the awards are focused on 4 categories in science and medicine: clinical practice leader, public health leader, patient champion, mental health leader. Visit the Metrodora Awards website to learn more about the awards program.
Good morning, good afternoon, and good evening, ladies and gentlemen. My name's Vivian Law, and it is my pleasure to welcome you to this year's Metrodora Awards. I would like to thank you for joining us today from wherever you are in the world for this special awards ceremony, hosted by the International Alliance of Patients Organizations, together with title sponsor Viatris. The Metrodora Awards is inspired by the heritage of Metrodora, a Greek physician who wrote the first known medical text to be authored by a woman. The Metrodora Awards was first launched in 2020 to fuel the empowerment and recognition of women leaders in science and medicine. Following the success of the inaugural event in 2020, this year, the International Metrodora Awards will continue its legacy to recognize women leaders and innovators in science and medicine in emerging markets. Women continue to play a leading role in driving scientific and medical breakthroughs. With each passing year, outstanding women remain committed to breaking barriers about their participation in these fields. Today, we gather here to celebrate women who have made significant contributions across all disciplines of scientific research, clinical practice, health education, health policy, mental health, as well as patient advocacy. But before we start, I'd like to take this opportunity to thank our judges, Professor Abla Sabay, Professor Ayase Karade, Kenji Lopez Cuevas, and Kawadip Semi, for taking the time and effort to select our finalists and winners. Thank you to all of you. Now, it gives me great pleasure to introduce to you Dr. Rena Devi, Chairperson of International Alliance of Patients Organizations, IAPO, to give the welcome remarks. Dr. Rena, please.
Thank you, Vivian. Hello, everyone. Good afternoon from a very warm and sunny India, and a warm welcome to the 2022 Metrodora Awards. It's a privilege and pleasure to have you join us today. IAPO is a global organization working for patient-centered healthcare. We work with 276 plus patient groups and alliances in 72 countries, representing 52 plus therapy areas. Our work focuses on changing policy, creating an enabling environment by empowering patients and caregivers, and enhancing research. It is our pleasure and honor to bring to you the Metrodora Awards in its second edition. I would like to begin by thanking all the people who have helped make this award possible. Thank you to IAPO and its team and Beatrice and its team for putting in your time, efforts, and support to make the award possible. Thank you to the GCI team for organizing and putting all of this and the event together. Thank you to all the nominees, participants, and the audience for joining us today. Thank you to our esteemed judges who took the time out to evaluate all the nominations. My special thanks to all the judges. The Metrodora Awards is inspired by the heritage of Metrodora, a Greek physician who wrote the first medical text to be authored by a woman. The International Metrodora Awards is an initiative designed to recognize women leaders in science and medicine. The awards are hosted by the International Alliance of Patient Organizations, IAPO, together with title sponsor Beatrice, to acknowledge outstanding women in science and medicine who have made significant contributions across all disciplines of scientific research, clinical practice, health education, health policy, as well as patient advocacy in key emerging regions of Asia, Latin America, Africa, Russia, and the Middle East. The awards will provide an important opportunity to raise the profile of women, celebrate achievement, and showcase success. They will hopefully inspire more women to join science and medicine and contribute to various disciplines of science. The first edition of the awards was in 2020, where we recognized four women leaders. 3 women science and health leaders were awarded for the inroads they have created into their professional legacies. Dr. Susa Bagoli, Assistant Professor, Faculty of Medicine, University of Debrecen, Hungary, was recognized as the developed nations leader in science and health. Associate Professor Chow Hua, Director, Center for Health Professional Training, University of Medicine and Pharmacy in Ho Chi Minh City, Vietnam, was recognized as the emerging nations leader in science and health. Professor Lale Tokzoglu, Professor of Cardiology, Hacettepe University, Turkey, was the winner of the Global Leader in Science and Health Award. This year, in the second edition of the award, we have 4 categories: Clinical Practice Leader in Science and Medicine, Public Health Leader in Science and Medicine, Patient Champion in Science and Medicine, and Mental Health Leader in Science and Medicine. Women continue to play a leading role in driving scientific and medical breakthroughs. With each passing year, outstanding women remain committed to dismantling barriers about their participation in science and medicine, especially in fast-growing economies. Thank you again for joining us today as we celebrate exemplary women leaders and recognize their contributions to science and medicine. Please sit back and enjoy the program. I hand over to you, Vivian.
Thank you, Dr. Ratna. I'd like to now invite Lara Ramsberg, Head of Corporate Affairs at Beatrice, for an opening speech. Lara, please.
Thank you, and good morning, good afternoon, good evening, wherever you may be. I am just so excited to be here today for the Metrodora Awards to celebrate the many achievements of women leaders and innovators in emerging regions. It's also a real honor for Beatrice to be working with the International Alliance of Patients Organizations to provide a platform of recognition for women in science and medicine. As we all know, striving to achieve equitable gender representation in all areas is important. More diverse perspectives and conversations lead to better outcomes. We need more female voices in the room and around the table. But for me, I think this is especially critical in science and medicine, where thinking about and understanding both the male and the female body when doing research, coming up with treatments is key. And that may sound fundamental, but even though that's the case, many often don't realize that, take for example, cardiovascular disease, that we know is one of the leading causes of death among women worldwide. It wasn't that long ago that women began being included in clinical trials related to cardiovascular disease. and that even today, they still remain underrepresented in many cases. I'd like to think the more women we have conducting those trials, the more that becomes less of a reality. And as a former colleague of mine likes to point out, just take a minute to think about the anatomy chart that we've all grown up looking at and that medical schools teach from. It's the male anatomy that we use as our frame of reference. And I don't have to tell this group that that doesn't always represent the female anatomy in every way. But how many of us have ever really stopped for a minute to even notice or think about that? Because if we did, we'd realize the unbalance that applies from the very start of the conversation. And I have to say, when it was pointed out to me, it was a real aha moment because I couldn't believe I'd never thought about it before. It's these types of implied biases that affect us, even if just in our own minds, because the minds of boys and girls work differently as well, not just their bodies, which can sometimes compound the issue. Many girls feel a need to be perfect. If they don't do well on a math test, they must not be good at math. If they don't like dissecting a frog, then they must be bad at science. And as an adult, if they don't have every skill listed for a job opening, they sometimes often just don't apply. From my experience, most boys and men don't think this way because they've never really had a reason to. It reminds me of something I heard from a CEO at a World Economic Forum panel a few years ago. He was a lawyer by trade, but the CEO of his company, which is a major international company that you would all recognize, saw him as a potential successor to the CEO role because of his outstanding leadership qualities. So his CEO approached him one day and said he wanted him to become chief financial officer as part of his growth path. The lawyer said, "But I'm not trained to be a CFO." And the CEO said he believed he could learn and would put people around him to help him grow into the role. The lawyer / now CFO did learn and did transition to become a very well-respected and highly capable CEO. And as CEO, he realized that the opportunity given to him to stretch his career is not all that unusual for a man, but is incredibly unusual for a woman. And he was working at his company to change that. It was another aha moment for me because as soon as he said it, it resonated as a reality for many women that I know. And one of the reasons why women and girls have been ingrained to think differently than men and boys for so long. It's also why, if we are to achieve real equality, it will take all of us, all genders, all women, all men, challenging our own biases and our own status quo. Just a little bit of awareness, education, mindfulness can go a long way. And that's where you come in. You should be so proud of the path you're paving for yourselves, but also the opportunity you have to help shape the path of others. You now have an important seat at the science and medicine table. And I personally have no doubt that you will use it to truly change the world, one aha moment at a time. Congratulations.
Thank you, Lara. We will now proceed to the awards presentation session of our ceremony. May I now invite Dr. Shekha Parkar, Regional Chief Medical Officer at Viatris, to present the first award of the day, Clinical Practice Leader in Science and Medicine. Over to you, Dr. Shekhar.
Thank you, Vivian. This is a great privilege to be here to introduce science and medicine. At the outset, I must say that clinical practice, when we look at clinical practice, it can be viewed as a culmination of advances in science and medicine. And it continues to evolve as we gain new knowledge and its translation. So we are so very privileged to be here today to recognize outstanding contributions of our finalists in this clinical practice category. These finalists have demonstrated outstanding work in the development of clinical practice guidelines, in driving clinical programs, as well as bringing out a positive change in their communities. So we have Doctor, can we have the slide? Can we display the slide of the finalists? Yes, thank you, Vivian. The finalists are Dr. Daisy Acosta, medical doctor and investigator at Universidad Nacional Pedro Henrique Urina at Dominican Republic. Then second finalist is Dr. Nilika Malavij, who is the professor and head of the Department of Immunology and Molecular Medicine at the University of Sri Jayawardhanapura, Sri Lanka. And finally, we have Dr. M.V. Padma Srivastava, Head Department of Neurology and Chief of the Neurosciences Center at All India Institute of Medical Sciences, New Delhi, India. And Dr. M.V. Padma Srivastava.
Thank you so much. It's so empowering, at the same time it's so humbling. Thank you. You know, as it's like a shot in the arm. It's giving you the impetus, the zeal, the zest to do more. In my profession, I'm a clinician. And to me, I believe that health cannot be a luxury. You know, you can't barter health to haves and have-nots. It's my fundamental birthright. But you know that in many parts of the world, there are geographic regions where it is, right? So health needs to be given. The optimal healthcare has to be available, has to be accessible, has to be affordable across the social, economic, and geographic barriers. And if, as a clinician, I can make a little contribution to achieve that end, it's a huge achievement. And as a neurologist, as a strokeologist, I'm aware of the humongous stroke statistics. Dr. Ratna is here, and she would agree with me that as I speak, every 20 seconds in India, we have a stroke. Every 2 minutes, there is a stroke death, and it's a huge societal burden. So if I can contribute to this stroke chain of survival in some way, and I think this award is giving me that, it's making me charged up. My batteries are charged. I think I can forge ahead. And, as it's been said just now, that there do exist in this world still, where as a woman, there are these, you need to break those barriers. As a woman, you probably don't even have a choice of your own life. There's a struggle for a right to life. Forget about the freedom of, what to wear, how to speak, whom to speak, whether you go out, your profession, your faith, your religion. As I said, the right to life as such. Breaking those barriers and to go where your heart can take you, that's an achievement. And I think I would like to dedicate this award to all the women and the men who help, who strive to break those barriers, to be able to, for us to reach our goalposts. And I do believe that the woman has the power. She is a powerhouse. And those two quintessentially important characteristics which define a woman, it's patience and empathy. That's why we say Mother Nature, we say Mother Earth, right? So I think it is those qualities which drive us further, and I do believe that this award has given me that kind of power, I feel this recognition is empowering, and I'm really humbled that I will show to you all that I will probably raise the benchmark, the bar, and try to achieve more. So thank you all once again, and God bless you.
Congratulations to Padma for winning this year's Clinical Practice Leader in Science and Medicine Award in what was a very strong field of finalists. And also thank you to Dr. Shekhar for presenting the award. Now let's invite Dr. Linda Bedrin, Head of Corporate Affairs, Emerging Markets at Viatris, to present the award for Public Health Leader in Science and Medicine. Dr. Badran, please.
Thank you, Vivian. Good morning, good afternoon, and good evening, everyone. This is my second time to join the Metrodora Awards, and I'm so pleased that you get to support women in healthcare who are making such remarkable headway in their specialist fields. While the journey for each woman here tonight is unique, the reason why we are here is the same. We are here to recognize you for your accomplishments and to celebrate your commitment to dismantling barriers and the challenges women are faced with in the healthcare industry. It is my absolute pleasure to honor the outstanding women leaders who have contributed greatly to the public health system in their countries. Thank you to all our finalists for their ongoing achievements in healthcare systems and health policy, especially in policy shaping activities, advisory council, and regulatory related work. The finalists for Public Health Leader in Science and Medicine are Dr. Ibtihal Fadil, founder and chair of Eastern Mediterranean NCD Alliance, Amwaj, Bahrain. Dr. Kulkania Chokipai Bulkit, professor of pediatrics, Faculty of Medicine, Siriraj Hospital, Mahidol University, Thailand. And Dr. Lizo Zuke, pediatric cardiologist and vice president of South African Medical Research Council and director of Children Heart Disease Research Unit, South Africa. And the winner is Dr. Lizo Zuke. Congratulations, doctor.
Thank you so much for this great honor. Thank you, Linda, for your introduction. As a woman in a male-dominated discipline, it is especially meaningful as these awards really focus on the contributions and the achievements of women to science, to medicine, to innovation, and therefore to the public at large. I'm also really deeply humbled to be able to make a few short remarks. As a young girl growing up in apartheid South Africa, becoming a doctor, let alone a pediatric cardiologist, seemed like an unattainable goal. Anything I may have achieved has been on the shoulders of giants. And today at the Metrodora Awards, I would like to particularly acknowledge the formidable women in my family, especially my grandmothers, my mother, and my two sisters. They have inspired, supported, and empowered my journey, and I truly am deeply grateful for their incredible influence on my life. To those young girls out there watching that may have really big dreams, especially in science and medicine, know that with tenacity, with courage and effort, they are within your grasp. But also be assured that the amazing nominees and winners here today, as well as many other people, are out there actively working on clearing your runway. I've dedicated my academic, clinical, and research career to public service. My passions are rheumatic heart disease, a disease that disproportionately affects the poor and disenfranchised, and congenital heart disease, although the #1 birth defect in the world, affecting 1 in 100 children, one sees a substantially decreased prognosis for those who are born in low and middle income countries. I've been blessed with caring, committed, and deeply passionate colleagues throughout my career. And much of this award is due to our collaboration and joint efforts. So a very special thank you to my mentors and colleagues along the way from the University of Cape Town, Red Cross Children's Hospital, Groote Schuur Hospitals, my new colleagues at the SAMRC, and particularly the members of my own team, the Children Heart Disease Research Unit members. Part of the responsibility for breaking the glass ceiling is to ensure that you also build the rungs of the ladder for others to achieve their great heights. I've been deeply fortunate in having wonderful women that have done this for me. but even more so, some incredible he for she's. My father, my husband Alexander, and my children, Gabriel and Eli, have unflinchingly supported my career and all my endeavors and work while excelling in their own. You are the wind beneath my wings and my greatest joy in my life. So I'd like to end really by thanking IAPO for hosting these awards and Beatrice for sponsoring them, and all the members of the selection committee for your trust in all of us and in awarding me this great honor. I would like to dedicate it to children that are affected by childhood onset heart disease, especially those living in low and middle income countries. May the next decade bring more equity in this area. And as we all work together, may we improve their lives. Once again, a really great thank you so much indeed.
Congratulations, Liesl. You are a truly worthy winner of this year's Public Health Leader in Science and Medicine Award. And thank you, Dr. Bedran, for presenting the award for us. Now let's invite Dr. Rena Devi, Chairperson of IAPO, to present our next two awards: Patient Champion in Science and Medicine and Mental Health Leader in Science and Medicine. Dr. Retna, please.
Thank you, Vivian. In the field of science and medicine, when we celebrate innovation and breakthroughs, it is also essential to acknowledge the efforts of devoted healthcare professionals who do everything they can every day to make patients' lives easier and to support patients on their road to recovery. The Patient Champion in Science and Medicine Award is specially created to honor and recognize these efforts exerted by healthcare professionals who advocate for patient-centered care and support. The finalists for Patient Champion in Science and Medicine are Anita Abu Bakr, Founder and President of Mental Illness Awareness and Support Association Malaysia; Phung Thi Nguyen, Head of Department, Phongsu Medical Oncology Department, Vietnam; and Eva Njenga, Doctor of Kenya Medical Practitioners and Dentist Council, Kenya. And it is my honor to present the award to the winner, Anita Abu Bakr. Congratulations, Anita. I have the privilege of knowing you and seeing your work. I invite you now to say a few words.
Thank you so much, Dr. Retna. I'm speechless, but honored and grateful. I've never won an award since my diagnosis and doing this work. And I am very grateful and I appreciate the inclusion very much. All praises is to God. I'm deeply and incredibly humbled and honored to be acknowledged winner for the Patient Champion in Science and Medicine for the International Metrodora Award 2022. Hosted by the International Alliance of Patients Organization and Beatrice, supported by Beatrice. I'm truly humbled and grateful for this recognition, truly being grouped together with remarkable women, inspiring individuals who do great work across the globe. And especially thank you to the whole organizing team of the Metrodora Awards, the judges who've been so kind, and of course, everyone involved for creating such a platform recognizing women leaders and innovators in science and medicine. But no one does it alone, and definitely not me. And I began this work with the intention of, I've struggled, I understand pain better, and desperation is something I know all too well, and I'm truly fortunate, and I acknowledge the privilege being able to do this work, and I have tremendous support from my family and friends. And as we all know, in this work that I do, stigma, discrimination, injustice, and human rights abuses are, very familiar in the work that I do and in what many of my peers experience. So obviously, I'm, really hoping through this recognition that it will strengthen voices of peers, that it will catalyze the advancements of rights of peers, accelerate sustainable solutions, and destroy stigma, because no one should be shamed or made to feel lesser of a human or lesser of a person or lesser in value just because of their condition or circumstances or trauma. And recovery is possible, and thriving in this journey is achievable. We all just need support. We need to be heard, and we need someone to give us a chance. And obviously, this award is a collective effort of many good people that I've met along the way that have done a lot of good work. And for those whom took a chance on me, who believed in me and in my work and the cause that I champion, and for paving way. And I would like to take this opportunity to thank, especially to my mom, to my husband, Juan, to my kids, Dahlia and Farid. Of course, I have to mention their names. You know, you guys are all my reasons, and I couldn't have done it without you guys. And I love you very much. To my dad and siblings, thank you so much for your utmost support and for rooting me on, for cheering me on. And a couple of people, to Dr. Abu Kadir, Dr. Hazli, Ustaz Muhammad Noor, Dr. Hazrat Prof. Mahani, the board members of Miasa New and Old, thank you for giving me a chance and believing in me. And of course, my friends who were there during my darkest of days, thank you for your support and thank you for having my back. You know who you are. And to my entire team at Miasa Malaysia, my staff members, my interns, my volunteers, my associates who work so hard every single day with me in this journey, especially Farouk, Hanisa, Alia, Divina, Prashdan, for your consistent support and for making this win possible. And those of you that have supported me throughout, and especially to all the mental health heroes across the globe, my peers that continue to fight this fight, that continue to thrive this journey despite your struggles, and for advocating this cause. You are the true heroes, and this is for you. This is a big win for patient and peer advocacy across the globe. And I hope this inspires women and children to know that you can make a difference, you can make an impact, be transformative in your actions. And I also hope this will inspire others to help, and for those that are struggling to find hope and to thrive, because you can. And last but not least, please take care of your mental health, of course. Let's continue to fight stigma, discrimination, human rights abuses, and promote good practices collectively. Let's build a safer and better world for the future generation and the generations that follow. Ini merupakan satu penghargaan yang besar buat saya dan sumbangan saya buat Malaysia. Thank you so much, everyone. Let's build back better. Let's build change better. Nothing about us without us. Much love and solidarity. Thank you very much, everyone. It's truly an honor.
Thank you, Anita. That is truly inspirational, and congratulations once again.
Thank you, Dr.
We move on to the last, but certainly not the least, final award of this year's Metrodora Awards, the award for Mental Health Leader in Science and Medicine. When we talk about healthcare, it's important to also include mental health, which has been an increasingly important topic globally, especially during the pandemic and the post-pandemic period. Though mental health has been and is still regarded as a taboo in the society, our finalists have been dedicating their lives work to champion for mental health patients, creating opportunities for strengthening the awareness on mental health and meet the growing need for mental health support and treatment in the society. The finalists for Mental Health Leader in Science and Medicine are, my pleasure and honor to read the names: Hunmi Akindejoy, Arts Mental Health Facilitator of Global Brain Health Institute and Atlantic Fellows for Equity in Brain Health, Nigeria; Ishtar Ovaya, Senior Lecturer in Epidemiology, University of West Indies, Mona, Jamaica; and Mariam Nourouzian, Professor of Neurology, Tehran University of Medical Sciences, Iran. And the winner is, congratulations, Mariam Nourouzian. You are a winner, and it is over to you for your few words. Accepted.
Distinguished guests, ladies and gentlemen, this moment means so much to me. I'm honored, humbled, and deeply proud to be amongst the incredible list of finalists for the Metrodora Award. I'd like to thank the esteemed judging panel, award selection committee, and votaries for the recognition and for their mission to encourage women leaders in science and medicine from emerging regions to drive positive change and inspire more women and girls. I would also like to thank invaluable support of Society for Brain Mapping and Therapeutics, SBMT, who nominated me, with special gratitude to Professor Babak Kateb, the founder of SBMT, which connects, inspires, and empowers science engagement organizations and professionals. I must also mention my deep gratitude to appreciate the Alzheimer's Disease International for their dedication and valuable contribution in providing a rich scientific network and promotion of science among the researchers in this field, and in specific in the low and middle income countries. Thanks to all my professors at Tehran University of Medical Sciences, and specifically Ruzbe Hospital, where I started working on dementia and neuropsychiatry in 1998. Special thanks to my wonderful family because of their unconditional love and emotional support, and all my team, specifically my great research assistant, Dr. Farnaz Younesi. Finally, I'd like to appreciate all my patients, from whom and their sufferings I have learned so much. Part of my journey that brings me here today has been about my challenges as a woman, physician, and scholar who resides in Global South, figuring out solutions for essentially two types of barriers. The first one, I believe, one of the most limiting factors that hinder us from achieving our goals comes from within. I have learned that living in our goals and dreams is the key to unlocking any achievement, despite all negative attitudes by society that may give us the feeling of hopelessness, guilt, and incompetency. The second category of obstacles has been external factors, such as frames that are imposed on us by culture, society, regulations, or media, that have historically disadvantaged women in their path to achievement due to nothing else but their gender. Yet, despite these historical and current barriers, I'm here today and proud to represent many other women who are believing in themselves and achieving their goals and dreams despite many constraints. We can go beyond the limits. Nothing compares to the impact of a strong motivation, lifetime learning, hard work, persistence, and resilience. Thank you again for having me.
Thank you, Mariam. And congratulations once again to Anita and Mariam for the exemplary achievements in patient advocacy and mental health. And thanks again to Dr. Retna for presenting the awards for us. Now let's invite Manasi Tadasi, President of Emerging Markets at Viatris, to deliver our closing remarks.
Good evening, everyone. On behalf of Viatris, I would like to thank Kualadeep, Dr. Ratna, Laura, Linda, Dr. Shaker, and our esteemed judges. I'd also like to congratulate all the finalists and the winners. I'd also like to thank the International Alliance of Patient Organizations. Viatris is a proud partner to acknowledge these outstanding women in science and medicine. Their achievements are worthy of recognition. We celebrate it tonight because we know that it's likely come with many challenges to be able to get here. Despite constant efforts, women are underrepresented in the fields of science and medicine, especially in emerging markets. In my own experience in the healthcare industry, I know we're not immune to systemic issues that women face in the workplace. I have countless examples of unconscious bias, lack of role models, and champions to be able to support women in their career advancement. Yet, our industry could be a powerful catalyst for wider societal change. I believe we have an opportunity to make an equitable path for career advancement by fixing the meritocracy system, by providing unbiased and fair opportunities for everyone. That is why awards like Metrodora Awards are so important. By giving women the platform to be able to boost awareness of their initiatives and achievements in the workplace, we help to inspire young women and girls everywhere to know what can be achieved with determination and dedication. I hope through the Metrodora Awards, we're taking one step closer to making a difference for women in science and medicine here in emerging markets. Thank you again for joining us at this year's award ceremony, and congratulations to all the winners again. We look forward as Beatrice to partnering with IAPO in the future to continue our efforts to support women in the industry and to make a difference in the world. Thank you and good night.
Thank you, Menasee. Now let's invite Dr. Retna to share a few words.
Thank you, Vivian. The Metrodora Awards gives us an opportunity to pay tribute to outstanding women in science and medicine. I'd like to congratulate all the winners for their outstanding contributions and thank all our finalists, judges, award presenters, and attendees for making this year's Metrodora Awards a huge success. Women, as we know, play an important role in driving positive change in science and medicine. And every woman who participated in this year's awards is an inspiration to other women and younger generations. We are extremely proud as IAPO to have provided a platform for women in emerging economies to recognize and showcase their achievements. We hope to continue to promote gender equality and positive change across all disciplines of scientific research, clinical practice, health education, health policy, mental health, as well as patient advocacy. Thank you everyone for attending today's program and look forward to seeing you again in the next year's Metrodora Awards program. Thank you, everyone.
Thank you, Dr. Retna. We are coming to the end of the 2022 Metrodora Awards ceremony, and I'd just like to reiterate how inspired we are with the achievements of all the nominees, finalists, and winners in their respective fields. Congratulations once again to all of our winners. Please follow the Metrodora Awards LinkedIn page to watch the award highlights. On the screen right now is a QR code. Would appreciate it if you can send a few minutes to fill it out and share some thoughts on the event with us. Thank you once again for joining us today and see you in 2023.